Welcome, everyone. Thank you for joining us for another NetHope webinar. My name is Madeline No, and I'm with NetHope. And we're very pleased to welcome DataKind, SOS Children's Villages International, and CARE today to talk about unlocking the value of data through responsible data sharing. Before we get started, I'd like to go over a few housekeeping guidelines for our session today. We'd love it if you kept this interactive. Please open your Zoom chat window and put any questions or comments there for our Q&A session toward the end of the webinar today. And do stick with us for a little longer than normal. This is a 75-minute session rather than 60, so please stay for the Q&A. It's very interactive. Also, look for a follow-up email that will include a link to the recording for this session and any resources and links to the topics that are covered, and you can share that with colleagues. Also, we appreciate your feedback, so please do take a moment to complete our webinar satisfaction poll toward the end of the session. I will now hand it off to my colleague, Layla Toplik, NetHope's Head of Emerging Technologies Initiative. Layla?
Thank you, Madeline, and welcome everyone. Good morning and good afternoon. If we go to the next slide, I want to give you some context on the topic for today's session. So as this group knows really well, data is key to pretty much everything we do in the nonprofit sector. And sharing of timely, accurate, and representative data enables us to do our work better, to make better decisions, to develop programs and solutions faster in response to a more holistic view of the needs and the context. And while data sharing is beneficial in many ways, and we'll hear about many of the benefits in this session, it is also hard, and it comes with many challenges and risks, including around privacy and security. So the other aspect to consider is that there's no single approach to data sharing. So what we wanted to do in this webinar is to bring forward some of the practices, policies, and tools that are being deployed today to enable responsible and ethical data sharing in the nonprofit sector. And you'll hear from 3 different organizations, which is why this webinar is a bit longer. We wanted to bring 3 different approaches. And hopefully this will also inspire you to share how you are approaching data sharing and what you're learning. And we do want to invite you to participate actively in the chat and also to follow up with us as we prepare for NetHope Summit and let us know what additional topics and examples we should be discussing and sharing in October. So here's what to expect in this session. I've asked each speaker, each organization, so CARE, SOS, Children's Villages, and DataKind, to talk about a few topics. First, starting with a problem, what problem they're trying to address with data sharing and who the data is being shared with, and really focusing both on internal and external stakeholders. Then to talk about their unique approach to data sharing and explain what they're learning and specifically around the benefits and challenges to data sharing, and talk about specific practices, processes, and tools and policies that they're implementing to ensure ethical, humane, and responsible data sharing. I've also asked them to talk about some of the resources and infrastructure that are required to support data sharing within both with the internal stakeholders and the external stakeholders. So with that, and if we go to the next slide, it is my pleasure to welcome 3 excellent practitioners in this space who will be sharing with you their work. First, Emily Januk is the Senior Director of Thought Leadership and Knowledge Management at CARE. Welcome, Emily. Abhi Balakrishnan is the ICT Business Analyst for Enterprise Architecture at SOS Children's Villages International. Welcome, Abhi. And Larry Kilroy is the Director of Technology at DataKind. So it's a pleasure to have you here. I've asked each one of them to take about 15 minutes to tell you more about their approach to data sharing. And then we'll have a conversation, hopefully guided by many of your questions and insights. So please do post those questions in the chat window throughout the session. With that, I'll hand it over to Emily to talk about CARE's approach to data sharing. Emily, over to you.
Great, thanks. And if somebody can just either come off mute or drop a note in the chat if my video freezes, and I'll turn it off. I'm in Mali today and the connectivity is a little creative. So I'm going to talk today about Women Respond, which is a data dashboard CARE put together starting at the beginning of the COVID pandemic. And this was based on two things. One is knowing that the COVID pandemic was a huge impact on women, and it was a special impact on women. It was a huge impact on the whole world, but that there were really particular impacts on women around things like livelihoods, around things like unpaid care work, around things like gender-based violence that weren't really visible in most of our global data sets. They weren't really showing up in the kinds of policies and data dashboards you see around the world, but CARE was doing research with all of those, with many women in many countries. So we were trying to get to some global insights there. And it also came from the realization that humanitarians and development practitioners collect enormous amounts of data that we don't really use. In one estimate CARE has done recently, people in humanitarian crisis spend over 1 million hours a year answering questions from humanitarian actors that may or may not ever get used. And that's not ethical to be collecting data in that way that we're not going to do anything with. But we also realize some of the obstacles to using data are analyzing it, getting it into people's hands quickly enough, and thinking about what can we actually do? Are we getting it into the hands of people who can take action? And we were particularly focused on the idea of women who are leading in crisis. So while women are often not showing up in global data sets, they are taking action in their communities. And most data doesn't talk about that. It talks about negative coping mechanisms and not so much about leadership. So we were really thinking about how could we do this differently. Next slide, please. So as I said, some of those big problems we were trying to solve and to do differently than we had done before COVID was to understand those gender gaps, to pool data across a number of different places. Often we can look at data in one context and it's much harder to roll it up into global insight. We were trying to get better decisions. And how could we get better decisions that were happening in time to make a difference? Next slide. The other problem we had is that we had a lot of different kinds of data sets. So we had something we still do, they're called rapid gender analysis that we do in most crises. And all of a sudden we were doing 62 of them in a 3-month period, which we had never done at that scale before. They're very immediate, they're focused, they're a particular kind of questionnaire and a particular kind of tool. We were also doing comparisons and trends and having different pictures. And then we had things like needs assessments or post-distribution monitoring that might be happening in a community, they might be happening at a national level. So it was a huge variety of different data sets with different questionnaires and different tools that we were using and different apps. Every country had a different space that worked best for them, especially trying to operate at speed. And so how could we combine all of those pieces? Normally in a data project like this, you would agree on what the common questions were and you would decide here's the tool we're going to use, and you would roll out some kind of an app or data collection process where everything was harmonized on the front end. We didn't have that. And to be honest, it's not realistic for us to have that in most of our contexts. The data operation needs in Iraq are very different than in Ecuador. And so how do we think about coming to a global picture across such a complex environment? Next slide. So this is the first piece that we did that's called Women Respond, and this is the dashboard. And it's gone through a couple of prototypes now, so things look a little different on the dashboard. And we're continuing to iterate. We learn all the time about what works and what doesn't. But this rolls up all of our data into a global view. And we really wanted to make sure that we did that in an ethical way that protected the people that we work with. Do no harm is always our first consideration, and that includes responsible data. Next slide. So what that did for us, that dashboard, allowed us to take these different data sets that come in, and so those are the pieces on the top, and then you can see what comes out. So it allowed us to produce different kinds of reports. It allowed us to produce different kinds of graphics. It allowed us to produce different kinds of presentations and things like radio shows. So while the dashboard is beautiful and I really like it and find it very useful, the women in the communities we serve are not going to go look at a dashboard that's optimized for a desktop or a laptop. That's just not realistic. That was not useful to them. There are particular kinds of policymakers who might click on a link, but they're not going to do a lot of filtering and analysis in there. And so what it did was it allowed us to bring the data together in a way that certain people, anybody who wants to, but we have particular kind of curators or translators who spend more time with the data, who can then use that dashboard to get to insights that are informing decisions more quickly. But there is that translation piece. So there is a step in between, just putting the dashboard out on the internet and hoping for the best. We knew that building it didn't necessarily mean anybody was going to use it without some additional effort. Next slide. So who are we actually sharing with? One of the things we're most excited about is the process of sharing with communities. And that's something that's relatively rare. It's not that we've never done it before. It has happened at CARE, but it's not something we do consistently. And we know that it's something that doesn't happen consistently with research and data and monitoring and evaluation in most development actors, that actually getting it back to the people who gave you the data in the first place, whose lives that data represents, is not a step we take as often as we should. So that's one of the things we're very excited about. And I'll talk a little more later about what communities have been doing with that data. But we did see the dashboard wasn't enough. And one of the things we really had to do was pilot test, taking different kinds of visualizations and different kinds of messages back to communities and saying, which of these things makes sense to you? One that was interesting to me, most of the women we work with hate bar graphs. They don't want to see them. That doesn't tell them anything. It's just a bunch of weird lines on a piece of paper. They were much more likely to respond to things that were a number with an icon. And they were much more likely to respond to things that had a conversational element attached to them. So a radio show, some way that they could participate and ask questions. Having a field agent talk to them was something that was a lot easier than just looking at a bunch of graphics or looking at a bunch of tables. We also have been using it for CARE. So how are we making sure this is getting in front of project teams so they know what changes they need to be making in their own work? One example that we used early on is that as everybody was rushing to talk about PPE, women in Cote d'Ivoire were saying to CARE, you think this is a health problem, I think it's an economic problem. I'm not worried about a cough, I'm worried about starving to death. Help me figure out the economics. I don't really care about masks. And so that was something we started acting on very quickly because those impacts were hitting people in those communities very differently than they were hitting folks in national capitals or than they were hitting folks in the US. And it's also about centering women's own voices and experiences. So part of what we've done is there's a dashboard, and the dashboard includes then different videos and different kinds of qualitative data where people are telling their own stories, because it's just so important not to have everything be filtered through the sort of algorithm or the anonymity of the interface. That's all done with active consent. So people know when they're talking to us in that way, if there's a video, that they know the ways in which we will be using that. And then we've been also using the data and the way we analyze it for policy recommendations and asks outside of the organizations. We've been using it for, to put in front of donors and to talk to donors about where we might need to fund differently or what kinds of investments might be useful in the context of what's changing so rapidly. And we've used it to do things like influence the UN or influence the government in the way they are responding, either to a particular crisis or to the COVID response writ large. Next slide. So this is Raheel. She's one of the women that we shared the data back with. So she is in Niger. She's part of a savings group that's been answering questions regularly. And when we took the data back, Raheel looked at it and she said, oh, I see a hole here. I see a problem. So this data does not represent the ethnic minority community at all. They just don't show up here, which I didn't notice until I had this survey and until I saw the data set. I hadn't thought about it. But they're not here because none of the materials are available in a language that's useful for them. So she actually set up a radio show and an in-person education session that she did regularly in the minority language so that people could ask questions and people could learn more about COVID. And it was only when she saw the accumulated data that she was able to make that inference. And she was able to do something about it. Not only that, she was able to convince her local mayor to do something about that. So having data in a person's hands makes a huge difference. Next slide. This is one of the other stories I love about this data. So in Ethiopia, experts had been saying since the beginning of the COVID pandemic, look, girls get pushed out of school. A lot of those girls are going to end up getting married as children because those are sort of your options. You either go to school or you get married. And that's a problem. And so experts had been saying that, and everybody had been sort of nodding and smiling and saying, okay, but they weren't doing anything about it. And in Ethiopia, the data we were collecting was with adolescent savings groups. And the girl said, this is our biggest problem. Like whatever the rest of you think the problem is, for us, this is the biggest problem. And when they were able to take that data to the local government, so it wasn't just a girl complaining, so to speak, or an expert opining, they were able to take actual data to the government and say, here's what the circumstance is for us. That's when the government responded. So they invested money. They reached over 18,000 people. They invested in schools and additional like tutorial classes for girls. And they were able to get girls back in school. And they also organized these campaigns about not getting your daughter married just because the schools were closed. That was not happening until these girls were able to leverage data in a way that they couldn't have done by themselves, because they didn't have the ability to kind of collect it at that broader scale. But we couldn't have done it by ourselves either, right? It's those girls taking the lead and doing the advocacy that really made a difference. So it's that pairing of data with action that's really useful. Next slide. Next slide. There we go. So what are the benefits and challenges? The benefits are we can make better, faster, more equitable decisions that are actually informed by these women's needs and priorities. We're putting the focus on women's voices and leadership. And so one of the questions we ask all the time is, what are you already doing to lead? These women are in difficult circumstances, but they're not purely victims. And so putting that focus on their leadership has been really critical. We've been able to get more people involved in solutions. And it's helping us build a future data model. So it's built this foundation that we're continuing to iterate on and add to as new circumstances arise. Some of the challenges are how do we deal with the privacy issue? And I'll talk a little bit about that in a minute. Keeping it streamlined, and it's this like Christmas tree falling over. Everybody wants to hang something on the data system. Everybody wants to add one more indicator and one more nuance and just one more subtitle, and then the whole thing breaks. And we found we really had to stay very rigorous about stripping that back. The women themselves were a huge help here, because when we went to digital data collection, women just hang up the phone after 10 questions. They literally just refuse to keep answering. They're busy and they just hang up. So that really forced us to stay within some limits there. And then that idea of sort of technical, so the flexibility versus standardized. We can't expect every woman in every one of the 100 countries where we work to answer the same questions in the same way, certainly not in the same language. So how do you build that flexibility? And so people can be asking questions that are relevant and meaningful, and you can roll them up into global insights. And then I talked a little bit about translation, and I see there's a question in the chat there about this idea of purely having the bar graphs isn't enough. There has to be some translation about what does this mean? What do we do with it? And we have to have some people who are able to translate between here's what the technology does and here's what it actually says. So we did some experimenting with AI, and it took a really long time to be able to figure out on the AI end that income and livelihoods meant the same thing. And income plus livelihoods plus jobs should all get dropped into the same category. That was confusing for some of our tools and resources. So doing that translation back and forth takes some energy. Next slide. And then how do we make sure we do this responsibly? I started by saying, the first consideration is do no harm. How do we make sure we're really respecting the lives of the people that give us this data in the first place? One is that before we put everything into the data lake on the back end, and there's an Azure data lake that I can talk more about if that's helpful, we strip out all of the personally identifiable information and we aggregate to either a national or a regional level, so that you can't really go in and find a specific individual, and that there's no risk if somebody got into the back end of this database, which is protected with firewalls and other things. But if they got in there, there's nothing identifiable in the back end. When we're visualizing, if anything is a sample size smaller than 30, so if you filter to particular criteria, we just drop it out so that you don't run the risk of saying, I'm looking in this region for this ethnic group for this disability condition in order to try to find a particular person in their responses. So we just zero that out. We do make sure that everything is sex disaggregated. So it's not PII, but that is one of the pieces we keep in there because it's so critical for the work we're doing and the way we're thinking about it. And then, as I said, one of the biggest questions is around making sure the communities get it. That for us, that is part of being responsible, is that they see the data they gave us and that we tell them what we're doing with it. And then lastly, I will say we do use the most restrictive data code, and that was part of what got challenging in this, how customized versus flexible do you get? So we're either using GDPR or whatever the local requirements are for data collection, depending on which of those is the most restricted. I think that's my last slide. So I will turn it back over to you, Layla.
Just the resources slide.
Absolutely. Sorry, I can't leave without that one. And so this is the, one size does not fit all. And there's not going to be an answer for absolutely everyone. But what we found was we really needed to have a business owner, somebody who's understood why we were collecting data in 100 different ways and why that was important and what the context of that was, and somebody who really understood the technology. It's possible, I guess, on a smaller scale to have somebody who does both, but we didn't find that at all easy. And having those people partner very closely. And then who are those translators? Who are the people who can look at the data and say, okay, here's what that implies. Here's what we might need to do about that. And don't underestimate the need for that translation. Publishing a dashboard and saying, here you go, you can find whatever you want, has been wildly unsuccessful for us. And the more complex the dashboard is, the less we can expect people to use it without a sort of translator function. And then it was also about mindsets. We really needed to build small and test and adapt. There's always this desire to try to build all of the complexity at once. And we're still fighting that. We're still, kind of every week we get a question about why aren't these 17 things in there? And so how do you kind of keep that focused? It's not going to be perfect and it won't meet every need. And just acknowledging that at the beginning, there's no way to build a single dashboard that covers everything everyone wants. And getting really clear for us that the priority is the communities and what they're doing about it. And is it informing action? Helped us make a lot of those decisions. We also found, and this is one we're still working on, it's great to have a responsible data policy, but actually implementing a policy and support to implement that. What does that mean if I set my Kobo up in this way or that way? Reading a policy doesn't help walk you through that. So really investing in that implementation piece is important. And then being really honest about lessons learned, being really honest that, this part is not working or we made a mistake there, is something that you have to spend time focusing on. And that there can be a tension there with data projects. Everybody wants to talk about how great it is. Everybody wants to, get to the next thing and talk about this is a marvelous success and everything's working. It's hard to talk about this is the piece that isn't working. But all right. So I will, now I will stop.
Thank you very much, Emily. Well, just a couple of thoughts in this. I love that you've highlighted, first of all, shared your approach to data sharing, which is this format of a data dashboard, but really highlighted the importance of a mindset and around learning and iterating, and also being very clear about who you're serving, and that is the communities, and then shared how do you actually ensure the data flows back to the communities that could use it to improve their lives, and that is actually available in that right, accessible format. I can already see in the chat window that's inspired a few observations and questions, and please do keep those questions coming. Now we're gonna go to SOS Children's Villages that has a slightly different approach and addressing some of the different problems that they've encountered in their work. So with that, I'll hand it over to Abhi.
Thank you. Good morning, good afternoon, good evening to everybody in this call. I'm Abhi. I work with SOS Children's Villages International, and I am the product owner for the business intelligence practice in SOS Children's Villages International, and I also look at the enterprise architecture practice. Before I get into the slides, I'd like to probably set some context and probably provide some insights on how we do business in SOS Children's Villages International. So we as an organization have programs in over 135 countries, and data is constantly being generated in all of these locations. And to share data within a federation of 135 plus countries in itself has a multifaceted complexity. Just to name a few, I think the most complicated piece of this process is to try and provide consistent and on-time data to different departments and functions. So they're looking at the same artifact, but with different dimensional perspectives. This becomes a huge challenge when you have multiple time zones and you have to collect information so that the decision makers in the organization are looking at the same artifact. I think the second complicated challenge in our constellation is to really try and upskill functions and departments to really understand the semantics that technology specialists use versus what is interpreted in the business context or from the programmatic side. So to try and reduce this understanding gap, this really is something that we as an organization have invested quite a lot of time and effort and to try and close this complexity. And finally, there are many conventional problems that rely on data-driven decisions, and we already have a huge repository of existing artifacts that can be reused, and to provide visibility to functions and departments to have access to these artifacts in itself also has some administrative challenges that we have to overcome. But with all of this, this really helps business functions and departments to create better data visualizations. If you can go to the next slide, please. So how did we approach data sharing, and how did we foster data sharing in our constellation? I'd probably like to split this into three different approaches. The first is the strategic approach of what we wanted as an organization, and the next two would be how we operationalized the entire approach. So in SOS, we took a conscious decision to create an easy to use data repository that all functions and departments can use. And this enables a self-service operating model for reporting implementation. So some of the principles that we took on board in this entire project was to have this artifact as a single source of truth. So this common repository provides a holistic view on the organizational data by combining data out of its existing silos. As I already mentioned, simplification. I completely understand the complexity of data wrangling, data modeling, the entire ETL process of trying to bring the artifacts in a way that visualizations can be embedded on requires a lot of time, effort, and competence. And to expect this from business functions and departments is something that we consciously said that we will centralize the entire transformation of data, and we then upskill report building. We also had correctness as one of our key principles, because our product owners and product teams would then have access to their data so that they can really easily identify the issues in their data, and they can make corrections so that the reporting layer has the right information. And finally, like I already mentioned, ease of use. We are really trying to enable as many report developers to try and build reports by themselves. If you can move to the next slide, please. Right. So how we modeled our schema for this common repository was that we in the international office have GSC, or the General Secretariat offices. We have technologies that we service to certain countries, and there are certain other countries that run independent technologies, and data is being collected from all these different sources. So our centralized data engineering team pulls all of this information and does the transformations, and the output of these transformations is a flattened data set. It can be tables, views, APIs, and this is then provided to departments and functions and super users as well. So if you could move to the next slide, please. In this implementation of a shared common data set repository, we immediately realized that it is equally important to have a data catalog. This provides a functional description of all the artifacts that is available here. What it does is that it helps coworkers really understand why and how indicators are modeled in our constellation. A data catalog of this common repository really helps the super users to start really asking more from their existing data. And much like any artifact in today's world, it's always subject to change, and we constantly engage with the different products to really ask if there are additional incremental enhancements that we can make to these artifacts so that a broader audience can leverage and use these artifacts. If you can move to the next slide, please. So as I mentioned, we do have an established business intelligence practice, and we've been providing business intelligence solutions since 2019. We realized that with this approach, we started to see a number of data sets in our technology that was redundant. By that I mean multiple departments are probably using the same artifact, but they're probably using this artifact to visualize things differently. So what we did was we tried to create a shared data set repository where data sets can be used as a service. This helped us to try and reduce the number of data sets we have on our technology solution. And we also had the opportunity to try and centralize some of the routines when it comes to data set refreshes. The next slide, please. And in all of this, I'd like to probably talk about some of the benefits that we had having a common repository that has holistic information regarding the organization. The first and the most important benefit is that we as an organization are best placed for a self-service operating model. By that, I mean the amount of resources that are required for report development is now shifted to the regions, to the countries themselves. The second important benefit of having a shared common repository is that we see the data literacy rise across the federation. The data catalog that we've built is being used not just to see and read up on how we orchestrate data, but also to onboard new co-workers across the federation and let them know the kind of semantics that our organization has. It also increases the transparency of all the artifacts that are created. And I'm very happy to say that we have reduced the lead times to build and deploy reports by having a centralized repository, and the report building is done by the regions and the countries themselves. And another important benefit in our way of working is that we were also able to onboard the legal teams early on in the implementation so that they can vet the artifact. Some of the challenges of having a shared common shared data set repository is the redundancy of data sets. I must admit that this is something that we're still working on, and we're trying to optimize the number of data sets, which means more functions and departments would have to start working together, and we're also trying to reduce the number of customizations that we have on the reporting layer. We're also trying to optimize the refresh cycles of our data sets. So in the General Secretariat's office, we are consulted and informed on the reporting, on the reports that are coming in. But what we also want to do is to try and optimize the data set refreshes so that our capacities are not clogged. And I think one of the biggest challenges in our organization is to try and have a global template, keeping in mind that co-workers within the organization would have to consume data as a part of the day-to-day operations. And if multiple dashboards and reports have a different layout and a different look and feel, it's very difficult to train each co-worker on multiple reports. So we are in the process of trying to create a global template, but like I said, this is a learning process, and this is one of our challenges that we aim to capitalize hopefully this year. If you can move to the next slide, please. Just to give you an idea of how the volume of reports that we have in our capacities is we have 61 workspaces, 742 data sets, and 370 plus reports. So this is a sizable number of reports and data sets that we have in our constellation. But We have also e-learning courses that we have created to ensure that co-workers who are interested in building reports have the kits and the toolkits and the ways in our organization to equip themselves for report building. We also consult and engage with report developers on tackling some complicated customizations on their reporting. But all in all, I'm very happy to say that this is a very sustainable way of implementing business intelligence solutions to scale in 135 countries. So if you could please move to the next slide. How we in SOS ensure data sharing is that we have a very strong data protection agreement for all products that are used in the technology stack. So the risk of sharing anything confidential and sensitive in the reporting landscape is eliminated because we have a very strong data protection agreement that clearly identifies how much of your data can be shared and how much is confidential. Cataloging data really helps in data sharing because from experience, multiple departments and functions have ideas and visions to try and create a reporting solution to handle their operational issues. But providing them a catalog of artifacts that already have data available and also a catalog of reports that are existing in our current capacities helps the functions and departments to reach out to other functions and departments so that there is some synergy and we are able to really try and reduce the number of data sets. And a part of responsible data sharing is to really have a strong position on what kind of aggregations you have on your data sets. So we are in a position to enforce certain levels of aggregations to scale a self-service style of report implementation. And finally, we also have data protection trainings that are run by product teams and departments. They help co-workers to really increase the awareness of what responsible data sharing is. And I think the most important part is that good data governance policy helps with fostering responsible data sharing. So if you could please move to the next slide. What resources we in SOS need to foster and support data sharing? I would probably broadly classify it into two buckets. The first is the people component. I think the most important part, especially when you're when you have an established business intelligence practice, is to have a strong set of report developers who are able to sustainably build and maintain reports. The second important part is super users and subject matter experts who provide requirements and endorse the value of business intelligence. And the co-workers who consume information in the dashboards are equally important because it is a part of their day-to-day business. And finally, the executive leadership, if they're able to embrace business intelligence and if they're able to move towards a data-driven decision, this is in line with digital transformation in our organization. And the process aspect is that we have very strong data protection policies and also incident response plans and policies should there be a data breach. And this really helps product owners to make decisions of how much data, when, where, why. And because we have a decentralized approach of report building, a standardized reporting development cycle would really help, because then we would be better placed to evaluate how much of load and is going to be on our capacities. And finally, communications and synergies within departments and functions to interoperably function to build sustainable reports. I think this is something that we as an organization aim to bring multiple functions and departments closer together so that they're able to really reuse what they're already generating. And this, in a nutshell, is how we embrace data within SOS Children's Villages International.
Great, thank you so much, Abby, for the overview of SOS's approach. And just quickly to summarize, we're talking about a self-service data catalog as a way to enable sustainability, reach. You mentioned 130 plus countries, and also timeliness of data sharing. And one of the things that you highlighted, which I think is very interesting in terms of the benefits, is using this approach as a way to level up data literacy across the organization, and the importance of having this approach being supported by a robust processes and policies related to privacy and security. There are a few questions in the chat window that your presentation has inspired, and we'll come back to them in the Q&A. Now we're going to go to Larry, and Larry will talk about both data sharing, but also introduce a new concept that has come up also in the conversations in the NetHopes AI working group, and that's around synthetic data. So I'm not going to say much more. I'll hand it over to Larry, and then after Larry, we'll go into the Q&A. So look forward to more questions. Larry.
Thank you very much, and welcome everyone. First, a little bit, my name's Larry Kilroy. I'm the Director of Technology for an organization called DataKind. DataKind, our mission is harnessing the power of data science and artificial intelligence in the service of humanity. So for today's presentation, could you go to the next slide? I want to talk a little bit about our work that we do with community health workers. We often partner with community health workers, with the organizations who provide software for community health workers, and with regional governments and national governments in trying to improve using machine learning and artificial intelligence and data science to improve the outcomes, the health outcomes of community provided health. So our challenge is in these issues, our realistic patient data is necessary for conducting research, creating public policy, and developing effective health applications and healthcare solutions. While this is known to be true across all health contexts, the lack of sufficient patient data in low and middle income countries and the existing barriers to collaborating on the limited existing digital data sets is a significant impediment to advancing the objectives of universal health coverage. And if we go to the next slide, I can talk a little bit more about the specifics of these challenges. So our role is trying to improve healthcare data quality through data quality assessment and testing for the purposes of this conversation. We work with both organizations that provide and build software like Damagi and Medic, with organizations that provide healthcare services like Brock, Luala, and Riders for Health. Not on this map is, of course, the government, in this case, in this specific case, Uganda, where we collaborate between all of these players. So data, in order for us to improve data quality assessment and testing through testing, would need to be shared between all of these entities. As you can see on the chart, patient data, while moving between the software providers and the organizations that provide healthcare services for both PII issues and regulatory issues, that data cannot realistically flow to us as is. So in turn, we wouldn't be able to return improved data quality, the testing tools required to improve data quality, and trust in the system. So if we go to the next slide, our approach has been to explore a relatively new concept called synthetic data. So by using synthetic data, which we'll talk about here shortly, by using synthetic data, it allows us to return benefits to both the organizations that build the software and the organizations that provide healthcare services by creating and using synthetic data sets in place of actual patient data, which replaces some of the security issues around PII and, of course, regulatory issues that would normally stop us from interacting wholly with all of these entities. So let's talk a little bit about what is synthetic data, if we can go to the next slide. So synthetic data is relatively new, and it's a concept that has gained both a lot of interest in the commercial space and in the nonprofit space with its potential to solve a number of problems, specifically around PII and regulatory issues. To explain a little bit better, I'm going to borrow some slides from a DataKind volunteer who worked for one of the leading providers of synthetic data in the commercial space, Gretel. So if we can go to the next slide. So what is synthetic data? To use an analogy, synthetic data is like replacing the pieces of a jigsaw puzzle to create a different picture, even though all puzzle pieces fit together in the same way. The overall image has changed, importantly and hopefully. The change is not discernible, but nonetheless protects privacy. So one way to think about this is while the puzzle pieces all come together the same way and act the same way, they are in fact a different picture. So it's really important to kind of think about this concept in terms of what we're trying to accomplish. We want data that behaves the same way as the actual data, but we don't want it to be able to trace back to any personally identifiable traits, and we certainly don't want to compromise any type of regulatory restrictions on sharing data. If we can go to the next slide. So what does this mean? I'm sorry, I lost track of the slide there on my screen. Too many monitors. So what does this mean? So by utilizing differential data sets that are reflective of real data, but are not actually the real data, we eliminate the possibility of something like a data breach happening where personally identifiable information is exposed. We want data that acts the same as the original data source, but looks different enough that no one's personal information is revealed. However, this usually comes with a trade-off. The more private your data, the less usable it is. Utilizing differential privacy and other methods, synthetic data can strike that balance of providing useful data while also keeping it private. Next slide. So if we're effectively creating synthetic data, this allows us to seamlessly share data through partners, through both government organization, the healthcare providers, as well as the software providers. Because the sensitive information is not present, if done right, we should be able to share all this data without worrying about permissions. We believe that this enables trust in data products in the community. So basically, one of the leading reasons people don't trust providing data to agencies like healthcare workers or software builders for that, or third parties like DataKind, is they're worried about what happens to their personally identifiable information. So by building trust in our products through not relying on PII to do any sort of testing. Finally, it augments small data sets. So as stated in the first challenge slide, in many cases, we're just missing data. There's not a lot of data, there's incomplete data. So by augmenting the smaller data sets, it allows us to do more robust and complete testing and modeling. Next slide. It also helps to remove bottlenecks and to streamline delivery. So this speeds the ability of software builders to build tools for community healthcare workers. It also speeds the ability of community healthcare workers to adopt newer features in software that help them improve the quality of care. So there's many ways that it does this. So the first is the data sparsity. So although we have extensive data pipelines and all our decisions are data driven, that isn't true all of the time. And that's because of the work we do, particularly in humanitarian organizations, isn't necessarily about the data, it's about the people. Each row of data represents a person. If we're able to collect a small amount of data and invest resources in making sure it's high quality, synthetic data can then use to add to that data source. So basically taking a smaller data set of real data and creating a larger data set of synthetic data not only will help alleviate some of the PII concerns, but it actually augments the data and makes it a more complete, robust testing tool. Second, the sensitive information provided by vulnerable populations is a real concern for most groups working in the humanitarian space. So in this case, we are lowering the threat of that data becoming available and to be used against a vulnerable population. if we are utilizing synthetic data. And then the last piece is the cost of data collection. Most of data collection in this space is done by hand and mobile, and it can be very costly. So by augmenting data sets with synthetic data, we lower the cost and the barriers for more robust testing moving forward. So what is DataKind doing now? We are generating synthetic data for product testing and tool demonstration for DataKind and Medic's Data Integrity Toolkit so that potential end user organizations can engage with the toolkit. And we're on target to complete that in 2022. Second, we're conducting a program to work to create synthetic data of high enough quality to conduct machine learning activities, support public health initiatives, and share learnings from the program to work to further de-risk the sector. And the target for that is next year. Next slide. So there's many known difficulties and challenges. The challenge to maintain correlations in individual distributions. So in synthetic data, we can't just generate fake data. If we do that, then many of the correlations and individual distributions will be off and therefore not usable for things like testing, and certainly not usable in thinking through things in the public policy space. Different data types require different methodologies, and ingesting different data types can provide issues as well. So making sure that our synthetic data set models the actual ingestion style and data types of the real healthcare data is a challenge. And then of course there's ethical considerations when using the sense synthetic data is built off of real data. We have to be sure that in the process of converting to synthetic data and creating synthetic data, we prevent PII leakage. And then, of course, the big one is replicating bias or introducing new biases. So any bias that's in the data we are building synthetic data from, biases can be exaggerated or amplified through building the synthetic data, and that's something we need to be careful of. So the current status, if we go to the next slide, the current status is the most mature synthetic data tool is not designed to be tailored for international context. It simulates synthetic patients with default demographics from US Census Bureau and instructions how to locate and use provincial data in Canada. And other tools are geographically agnostic. They take seed data and perpetuate the data architecture of those seed data. So neither of those are great solutions for us right now. So next slide. Here's a use case where we're starting to move forward with what's available in the next slide. So we want to avoid what's called the vicious cycle here that's demonstrated at the bottom. And essentially, community healthcare workers collect routine health monitoring data and critical inputs to monitoring and managing the provision of health services, especially in the public sector. Now, this cycle can be perpetuated in several ways. Inconsistent and problematic data getting created at collection. That can result in people don't trusting the data or the data not being reliable for decision making. At that point, people kind of give up on it, and then there's no comprehensive way to describe what happens next. We can go to the next slide. So our efforts with Medic are to provide a testing tool for their community healthcare toolkit. And this would be something that would test incoming data, and it would identify inconsistent and problematic issues on the generated data from community healthcare workers. We can go to the next slide. So DataKind has recognized the need to support Medic and is providing the multiple NGOs and government partners of Medic that use the community healthcare toolkit with an engaging experience, enabling them to test out of the box utility of the tool on a demo data set. And that demo data set will be made up of synthetic data. So we are currently designing a project to create a standalone synthetic data set to be released alongside our data integrity toolkit for implementation support and demonstration purposes. If we can go next. So relationships and data points that are needed in a data integrity testing synthetic data set. Care encounters with data is defined in core health treatment forms, household relationships, socioeconomic household data is defined in key surveys, and synthetic populations with appropriate geographic distribution. And there's an ethical requirement as well, which is because the data will be shared with partner organizations, it's imperative that we gain buy-in and approval for synthetic data sets from the community impacted or represented by the synthetic data. We can go to the next slide. So our sharing outputs that we're targeting are stable downloads of sample data sets, active maintain repositories of code. Eventually, we'd like to be able to generate and have users use our code to generate synthetic data sets for their own purposes, and an exchange to generate new data sets. So basically allowing a community effort to improve the quality of the synthetic data being generated. The next slide, I can quickly cover the benefits and challenges of sharing synthetic data. In the benefits column, synthetic data sets fit the requirement of having data sets formatted correctly for testing tools and training models in collaborations between several organizations, making sure that private or sensitive information will not be revealed. So this goes back to that first slide. It completely helps us get around some of the issues around PII sharing and regulatory data sharing. And as individuals at these organizations become more comfortable with these tools and models, the synthetic data set can be used to train others on using the tools. That's been one of the challenges with things like the Community Healthcare Toolkit, is getting new populations, new organizations to use the tool without sufficient training data, and synthetic data can play this role. Some of the challenges, of course, are in a synthetic data set, different geographies may have different issues and distributions based on contextual reasons, resulting in possible data distribution shift issues. So essentially what works in the US might not work in Uganda and vice versa. So we have to pay special attention to that. The other challenge, as I mentioned before, is replicating biases from the original data set the synthetics are built upon. We also don't want synthetics to introduce new biases. So that's another concern. So those are things that we are constantly evaluating and trying to learn more about and be aware of. We do have some resources. The DataKind Project Playbook speaks a little bit about our approach to how data gets used in these projects and how data gets shared in these projects. We have some blogs, of course, about this actual project with Data and Medic. And finally, our UK chapter produced the Practitioner's Guide to Data Ethics. And this really speaks to some of the ethical concerns that all practitioners must be made aware of, either using synthetic data or of real data. And with that, Layla, I'll pass it back to you.
Great, thank you so much, Larry. Thank you for highlighting this a completely different approach and a concept that is relatively new to the sector, this concept of synthetic data and how it can address some of the challenges that you talked about, like sparsity of high quality data, trust in providing data, cost of data collection, but also similar to Emily and Abby, just really emphasizing that this is not about having a perfect approach. It's about really having a responsible way to try it, to learn, to iterate, with the emphasis on and the focus on the community and ethical data sharing. So with that, I do want to come to the questions. We have about 15 minutes for to tackle some of the really great questions that have come through the chat window. Feel free to continue adding questions in the chat. We've also included everybody's emails to follow up if you have any additional questions or need additional information. One last ask to all of you as you're thinking about both the questions, but also what might be some of the topics that you'd like to explore on whether it's related to data more broadly or data sharing and data collaboration. We have the opportunity to really curate a set of sessions for the NetHub Summit that is scheduled for October 19th through 21st, and it will be virtual. So I'd love to invite Emily, Abby, and Larry to come on video. And then Emily, I'm going to start with the first question for you. And just coming back to really what and who this is about. It's about communities. It's about individuals, impacting individuals and communities that this data could, and their data can help them achieve their goals and also address the challenges that they're facing. So, but one of the key questions here that I think you sort of touched on when you talk about training, but if you can expand on the training that is specific to data privacy and security. As Monica notes, do you provide that kind of training so that the responsible data practices could actually start with the communities? If you can share that.
Yeah, it's an interesting question, and I have a couple of answers. I'm not sure that I'm going to answer the question in its entirety. So certainly when we're working with people who are doing data collection, enumerators, sometimes that is participants in a program, then there's some training there about what they can't do with the data and what that privacy protection looks like. We also have a really engaged, we call it an active consent process. So it's not just you sort of read off the laundry list at the beginning and get somebody to put an X on a page about here are all the things that may happen, but really engaging with people to say, here's what we're going to do with your data, and giving them several opportunities to opt out over the course of a survey, because usually that's done at the beginning. And sometimes you don't, I mean, even me, I don't always know what I'm getting into until I'm halfway through a survey and like, wait, you're asking me that question? Now I don't know how I feel about this. Doing sort of a formal wholesale community training on data privacy is not something we've done yet. So we do different pieces in different components depending on who we're working with. But it's a really intriguing suggestion. And Monica, if you have examples of that to share, I'd love to learn more about what you've done.
Excellent, thank you. Monica, feel free to reach out directly to Emily, or if there's a link you want to share, feel free to pop it into the chat window. Abby, I'll just actually combine a couple of questions, given that we have about 13 minutes left. So there's a question from Anders and another one from Monica, and all kind of related to this concept of responsible data sharing. And from Anders, Anders is asking if you're centralizing the GDPR responsibility / accountability, or do you delegate it to the users? So we're talking about users across 135 countries. And then related to this kind of global access to data and data protection, Monica is asking, how do you restrict access globally? And are there customized views for all functions in these different countries?
Yeah, so I could probably start off with the GDPR question. I think it's a very nice question, and my answer to this is that every co-worker in SOS Children's Villages International should take the IT security course, and this covers responsible data sharing as a part of a mandatory e-learning course that we have. So we bring IT security and data protection closer together as co-workers of SOS Children's Villages International. That is the first part. And product owners within our technology stack also have to look at data protection and GDPR within their products. So there are regular audits of each of these products to see if there are any vulnerabilities or if there is any loose ends in their product in its totality that is reporting included. So coming to the second question, when it comes to security, if I understand the question right, are there restricted artifacts also that is in our constellation? Yes, we do have other artifacts that are tailored to functions where there is sensitive information, but this is also curated, vetted, and ensured that there is security around it. And we also have reporting layer security with row level security, where you can also try and ensure that anything that is published as a report does not have any sensitive information.
Okay, great. Also, Monica, anything else to add?
Sorry, I missed the last question. Was there any? It was
so the customized views
yes,
for
there are
the specific functions. Yeah.
Yes. When as soon as we identify there is sensitive information, we flag this and place it in another repository.
Excellent. So Monica and Anders, hopefully this at least begins to answer your questions. If you need additional clarifications, please feel free to add them in the chat window. I'm going to move to next to Larry. Larry, a number of questions about synthetic data, some of which you touched on in your presentation. So let's start with a just a basic question around how is synthetic data better than exporting data sets without the identifiable fields?
Sure. So the primary way is when you have a case where the original data set that you might be exporting is incomplete or too small of a size to do any kind of meaningful modeling based on. So that's the most common case. The other is regulatory, where none of the data can be shared just by nature. So even if you remove the personally identifiable information, you're just maybe using aggregate data when you actually need kind of line level data. So those are two of the primary reasons that we were driven towards thinking about it. But in the world of programming already, there is a concept of synthetic data around kind of the fit for use case, where each business might have a particular need in or view of how they are, say, testing, if they're using it for testing, and want to be able to generate data that fits their specific use case and really tests all the edge cases for their particular application. So if you think of that, extrapolate that out to programmatically, every program is going to have different concerns that they're testing against or modeling. And those edge cases will be different from program to program. And synthetic data allows you to create data that really helps you understand and test and model those edge cases programmatically as well. So those are three of the primary advantages of using synthetic data versus exporting data without the PII.
Okay, excellent. I think that was a question from, I believe, from Kyle. So hopefully this at least touches on that. Great, Kyle. I'm glad to see that that was a helpful response. Also, Larry has provided additional resources. Emily, I want to come back to this just really important part that you brought up in your presentation, which is sharing data with the communities and doing that in an accessible, approachable, and actionable way. So if the organizations were to really consider how they might share the data back with the communities and empowering them to act on those key insights, what are the couple of key pillars or key steps that they should consider first?
So a couple of things to think about first are really doing that testing with community members about what makes sense to them and what's helpful for them. So, looking at a giant spreadsheet is clearly off the table as something that's useful. Like that's only barely useful for someone like me. And I spend a lot of time with spreadsheets. But different communities have different things. And one example I'll give is that we were using this little icon for food that was a plate and a fork and a knife. And we went back to a community in West Africa. And everybody said, what is that? Like, that's just not how they eat. That's not what food looks like to them. And so they didn't know what it was. So doing that user testing about really what makes sense. Another huge piece is around what is the conversation that happens and how is that facilitated? I'll give an example. A couple of years ago, we were working with something called a participatory performance tracker, where there was a big flip chart on a wall and communities would go score themselves, and it was part of a community meeting and everybody knew what was happening and they were having a conversation about what do we do and what does this imply. And we digitized that process, which made it much more convenient for us because you didn't have to do all the typing, and communities hated it. They hated it so much because they said it went from us having a conversation where everybody could see what was happening to a guy with a cell phone who never made eye contact, who asked a bunch of questions and hit a bunch of buttons, never even looked at us, and then walked away. We lost our ability to take action because now it was all about extracting somewhere else. How do you do both? How do you do the digital without undercutting that conversation? Because that's what really matters. The data is the launching point for that conversation, but it is not the end goal. So those are the two big ones. And then the third one is, how do you do that in a way that protects members of the community, right? So for example, we use the Washington consensus question around various kinds of disability. You get to a micro enough level and if you say, well, this is what people with this disability say, that could really only be one of 3 people in the group and everybody knows who said it. So how do you think about that piece when you're reporting back? Those are the 3 big ones I'd talk about.
Super helpful, thank you. And thanks for emphasizing the data is a launching point for the conversation, and that looks differently at a global versus local level in different communities too. Actually, somewhat related to that, I'm just gonna skip to Monica's question, and that's actually a question for all 3 of you, and it's just the reality that we deal with in the nonprofit sector and the humanitarian response, which is around connectivity. So how are we dealing with the internet challenges that affect the data sharing globally, and how do you ensure that we don't lose that inclusion because of the connectivity issues. So whoever wants to go first, I don't know, Abby, if you want to comment on that because you work across 135 countries.
Yeah, sure. I'll probably start with the first part. My first part is that in sustainable report development, you do have the possibility to extract all the data that you see on your visualizations on Excel and have an offline version. So, so as a part of best practices in report building, we also foresee that there could be theoretical possibilities where there is not enough internet, and they should have the possibility to extract all the information in Excel. So in all our reporting implementations that we do, we try to advise and advocate for analyzing artifacts also in Excel. So that's the first part. The second part is we also have certain projects where information comes in stages and phases, and all the stakeholders and all the project team members are well aware that information is going to come in a staggered fashion, and that is completely fine as long as it's written down and communicated to all parties involved.
Wonderful. Thanks for sharing this kind of balance between digital or online and offline approach. Emily and Larry, do you have anything else to add before we move to the next question? We have about 3 minutes.
Yeah, just one quick addition to that is not just like pulling data off and having that be an offline capacity, but anything that's data entry also needs an offline version. You just can't build anything that counts on having connectivity all the time.
Yeah, nothing to add except this is why we are exploring synthetic data, is because often connectivity issues can lead to the sparsity of data. And so that's something that we work with the community healthcare groups to understand what data would need to be created in order for them to train their field operations, for example. And that can help in that way. But that's really why we're exploring synthetic data as a solution where connectivity issues can be a problem.
Excellent. Thanks, Larry. And actually on that point, I know you briefly touched on that as one of the challenges when it comes to synthetic data, but just wondering if you want to elaborate on this topic that Priska brought into the conversation. It's really around synthetic data also being generated from the real data that might be inadequate. So poor quality, biased, not representative of certain populations. Anything in terms of the steps, but also just the awareness of that in the process.
Yes, so the first time we started exploring synthetic data, that was one of the first things that really made itself apparent. We did it as part of an event we hold called a data dive, where we work with a large amount of volunteer data scientists and nonprofits to explore a problem. So in exploring that problem and the potential solution of synthetic data, the first thing we noticed with all of the commercial tools available and the open source tools available was exactly that the data that was being built synthetically was, when based off of incomplete data sets or data sets with biases, those were amplified. So we're building into our processes methods where those checks are made at really the code generating the synthetic data level. So basically code, test, code, retest. And we are examining for both biases and for data that is incomplete in nature or poor. And there have been cases where we get, for example, patient data in the synthetic data that's not realistic. And so that is a clue for us to go back and look for where that sample came from and how you build off that. So using what we're using currently are open source patient data that's available, and those will eventually help us train our models to generate data that ignores outliers that would result in poor data being generated by our synthetics. And then, of course, like I said, those checks, so code, recheck, code, recheck.
Thanks for just double clicking on that topic. Certainly a space to watch, and we'll have even more conversations about synthetic data and in the months and years to come. Related to that, we are at the end of our webinar. There's still a number of questions, so I would encourage everyone to just follow up with Emily, Abby, and Larry. Also, follow up with me and let me know what are some of the topics and conversations and examples that we should be sharing and having at NetHope Summit. Hopefully, as mentioned in the chat window, this has been informative and helpful for your work. I certainly found it incredibly insightful, even after multiple conversations with Emily, Abby, and Larry. And thank you, Emily, Abby, and Larry, for sharing your work, emphasizing, again, this is all work in progress. We're learning and iterating, and hopefully we're going to continue the conversation at the summit. With that, Madeline, over to you.
Thank you, Layla. Thanks to all of our presenters today, and many, many thanks to our attendees for joining us today and sticking with us for a little bit longer than normal. Please do take a moment to complete our satisfaction survey. There's a link in the chat window, and it should pop up as a new tab on your computer. Also, look for that follow-up email that will include a link to the recording for this session, as well as all the resources that we covered today. With regard to Summit, go to nethope.org, and there's a tab for Summit if you want more information about how to participate, the call for speakers, etc. And again, thanks for joining us today, and have a great rest of your day.